Medicine is undergoing a lot of change right now. We'll talk about that in just a minute. But what's exciting for me about attending these events is at the time when I graduated medical school, 100 people was a pretty large gathering that had at their heart and soul helping people around them. That was the reason that they went into medicine. And now I get to meet with groups of 1,500, 2,000 that have that same heart and soul of helping people. And it's exciting to be with all of you, and it's an honor to meet with you and to talk with you and to have the privilege of addressing you in these summits, in these meetings. So thank you for having me. So Michelangelo was quoted to have said this: "To touch is to give life." And as you can see at the center of the painting on the top of the Sistine Chapel is this beautiful painting of God reaching down, touching man. It seems to be his central theme in many of his pieces of art, is this idea of touch. And I want to talk for a little bit today about why. Why is that a central theme for us? Emily, she hasn't seen this presentation yet, but these are a couple of pictures of Emily when she was in Nepal. And these two ladies, this beautiful picture of them, these two ladies did not speak the same language. But you can tell by the pictures there is an extreme amount of communication going on there. That moment they were communicating. Much of our business in doTERRA has to do with touching people. We say things like we're touching each other's lives. And then also the practicality of using essential oils is that we do touch people. We physically use our hands. We apply oils to the hands, the feet, the spine, parts of the body. I do the same in my career. I'm a physician, and so that's my job. I go from room to room, and part of my job is to lay my hands on people, touch them physically, understand their ailments through my hands, and then be able to help change that for them. So I also have I'm a professor at the University of Utah in Salt Lake City. And part of my job, I get to teach residents and medical students. They rotate through my clinic and we have some time. And I asked one asked me the other day, this was about 2 months ago, said, "Dr. Riggs, I noticed that when you're in a room with a patient, that you also touch them in non-clinical ways." And I found that interesting. And she asked, "Why do you do that? Why do you put your hand on their shoulder? Why do you put your hand on their arm? What is the point of that? You're not getting any information from that." And so that's what prompted this presentation. I thought, okay, so let's look into why. Why is that a natural part of my practice as I practice medicine? Because so much of what I do every day is touching. So as we get to that, the other question that is a why is, why are we such touch-oriented beings? Why is touch important to us? And what happens to our body physiologically when we experience touch? This is Dr. Keltner from UC Berkeley. Anybody from Berkeley here? All right, we got one. All right, good. Dr. Keltner is a leading PhD that studies touch, and he did a very interesting study. He built a barrier right down the middle of his lab, and he asked several hundred students to come in. And he divided them into two groups, and through the barrier, the one group would put their arm through the barrier. They couldn't talk to the person, they couldn't see the other person. The other group was asked to touch the person with the arm through for 1 second, and then was also asked to communicate an emotion through a 1 second touch. The list of emotions were there, and if you were to guess, just absolute guess, the chances of getting right is about 8%. Now that number is going to become important in a minute. Okay? So about 8%. So 1 second touches, communicating emotion, and 8% chance of getting it right. Here's what he found. He found that compassion can be communicated 60% accurately through a 1 second touch. Compassion, 60%. Gratitude, anger, love, fear, we get correct in a 1 second touch 50% of the time. That's pretty amazing. Now, there are some caveats that he found through this. Number one, when women tried to communicate anger to men, In a 1 second touch,
Failure.
we got it 0% correct.
Yep.
That's worse than guessing.
Yep.
Okay? So just know that when you touch your spouse, ladies, we don't get it. Please be very obvious about it. Now, let's flip that coin for just a second.
Yep.
Men, when we try to communicate compassion to women, also 0%. You don't get it when we're trying to say, oh, honey, it's okay. No, we don't communicate that very well through touch. So it's pretty important to keep in mind that we do have differences in the sexes and how we touch and how we can communicate through this. So beyond that, there's also, let's get to the next slide there. Touch is a language, and we innately know this language when we're born. And we'll talk about a little bit more about how we develop more and more of that in just a second. But through the face and voice, if you're not to touch someone, there is only one emotion that we have data that we can accurately describe, and that's joy. We can look at someone's face and determine if they're having joy or not. All other emotions we're very poor at looking at the face and listening to the voice and understanding exactly what that emotion is. So remember, 60% through touch, 60 and 50% through touch. Through joy is the only one that we can use the face. Also has a much broader spectrum of communication and is faster and easier. We'll talk about some examples of that in just a second with some basketball teams. But I want to read this. This says that if you're close enough to touch, it's the easiest way to signal something. This immediacy is particularly noteworthy when it comes to bonding. We feel more connected to someone if they touch us. So we can identify joy, love, gratitude, and sympathy through touch, but through the face, we can only identify joy. Touch improves performance. There was a study done, this is out of Urbana, University of Illinois, Urbana, by Dr. Krause. And Dr. Krause studied NBA teams. He went to practices before the season and documented with his students how many times players touched each other. And the question was, does this increase performance during a game? He found that the more often a team touches each other, the more successful they will be in the season. So I recently watched, anybody basketball fans here? Yeah. So March Madness, right, a couple months ago, as I was putting this presentation together for a talk in Orlando, March Madness was going on. And so I decided I would watch a game. I'm a U of A grad, so I watched my U of A Xavier game. Sad game. Sadly, they did not win. But as I watched the game and tried to predict who was going to win the game, just by how often players touched each other, I could have told you that U of A was going to lose. Because Xavier touched each other far more often on the court than did U of A, the U of A players. And so, as I watched this and looked at this game with new eyes, it became obvious who was going to win the game. And sure enough, they did pull ahead. Fascinating. And so you should watch NBA games now with a little bit of different eyes. There's also this. This is the Midas touch. Let's go back to that one. There we go. This was a study done because we've heard of the Midas touch, right? You touch things, they turn to gold. The Midas touch study was done by Tiffany Field out of University of Miami. And she asked waitresses to lightly touch on the shoulder or arm, the patrons, and determine, does that increase their tip? And sure enough, it increases their tip. So then they asked the people, the patrons afterwards, do you recall being touched? And it seemed to be independent of whether or not the touch was even registered by the patrons. So even if they don't remember being touched, it increased their tip size. So they had a larger tip. Also, touch communicates trustworthiness. Now I am not making a political statement here, okay? This is not politics by Dr. Riggs. But I found these pictures kind of interesting. Considering this study, it says that touching someone on the arm making a sales pitch communicates honesty, confidence, and well-informedness. Our brain seems to believe that only a true, knowledgeable person would touch us when pitching a product. This was particularly seen in same-sex interactions, as opposed to opposite-sex interactions. So it significantly also increases the chances of them agreeing to what you're asking. And it seems the larger favor you're asking, the more that touch plays a part in whether or not that party agrees or not. So as you look at these pictures, and I looked at lots and lots of pictures, so as you look at these pictures, here's President Bush, and every picture that I saw President Bush with President Putin from Russia, they were always touching. And almost every picture I found from President Obama, love the man, but every picture, there's always something between the two. Whether it be a flag, whether it be a podium, they are not standing together and they are not touching each other. So I found that interesting considering the relationships during the two presidencies. So what happens when we touch? Again, this is from Tiffany Field at the University of Miami. She took preterm newborns. And I will tell you, when I was in medical school, the thought was, as I did the NICU rotations, don't touch preterm infants, because the brain isn't developed enough yet for them to understand that touch, and you can actually cause harm to the developing neurologic system. So that was in the 1990s. Now, this research from University of Miami says they took preterm newborns, they did 15 minutes of touch therapy 3 times a day for 5 to 10 days, and found that those infants gained 40% or 47% more weight than those that were not touched. That is a significant increase in weight gain, considering that's a major problem that we have with preterms, is they just won't gain weight. And all along we're thinking, well, it's more calories, or they need this, or they need that. As it turns out, what they need, at least in part, is more physical contact with mothers. And that's pretty important. Lastly, what happens when we touch with this orbital frontal cortex? This is a study that was done out of Arizona State University by Dr. Edmund Moons. And they found that when we touch, the orbital frontal cortex is what's activated, this front part of our brain. The front part of our brain is where we store relationship information, where we store social cues, and where we begin to understand what's going on with people around us. So therefore, we're better at empathy when we're touching. We're better at social judgment, and then also interpersonal sensitivity, that idea that I can communicate with someone around me simply by touch, because this part of my brain, that front part, where also our personalities are stored, where that is activated by touching someone. So physiologically, here's what goes on. Oxytocin level goes up. Oxytocin is that happy, feel-good hormone in our brains. This rises as we experience physical touch. The heart rate goes down in an appropriate type of touch. Now, obviously, if I walk up to my little brother and I slug him, I don't think his heart rate goes down. But in appropriate touch, our heart rate goes down, blood pressure goes down, cortisol level, that stress hormone, goes down significantly. It stimulates the hippocampus, the part of our brain that stores feelings. Also, interestingly enough, a part of the brain that's very activated by essential oils when we smell them, the hippocampus. We release a host of hormones and peptides that have been linked to positive and uplifting emotions, again, through the hippocampus. It boosts our immune system. They did an interesting study where they took a number of people, there was about 400 people in this study, and they asked them questions about how often were you touched over the last 2 weeks, and how often were you hugged over the last 2 weeks. And then they checked them all into a hotel, so they booked the whole hotel, and they exposed them all to the cold virus. Now, who's going to sign up for this? Like, yeah! Let me just go get exposed to the cold. That's fun, right? So they exposed all of them to the cold virus. What they found, they were very effective at infecting people. 73% of those that were exposed got infected with the virus. Okay? What they found was 37% reduction in infectiveness, I guess if that's a word, infectivity, whatever you want to call this, but 37% reduction in those that were touched and hugged more often than those that weren't. So their immune systems were stronger at fighting it off. They found 32% reduction in symptoms for those that actually got infected but had a high amount of hugs and high amount of touching. So it seems to boost our immune system very well if we're touched. And when we're not touched, we're more likely to get sick and more likely to not do well. Also, this is an interesting study. They turn off the threat switch by activating the vagus nerve. So they took a bunch of people and they put them into a PET scanner, so determine what part of the brain gets activated. And they said, hey, in a second, we're going to blast some white noise into these headphones that you're wearing. And you're never going to know when it's going to happen, so we're just going to let you lay there in the PET scanner, and then all of a sudden, bam, there's this huge amount of white noise, right? And they determined that there's a part of the threat system of the brain that was really heightened, But as soon as the person was touched by their significant other, that threat part of the brain completely went off. Zero. No vagus nerve stimulation at all. So they were no longer, at least in the brain, afraid of getting this white noise. They've done the same test in children getting blood draws. When mothers can hold the infant during a blood draw, we find that there's much less trauma in the brain registering than those that are actually being told that they have to lay on the bed by themselves. So touch seems to mitigate the threat switch for all of us. We'll feel much better when we're anxious about something, when we're nervous about something happening, when we can be touched. Okay, next slide. So who touches? Children. Children touch all the time. We're touched no more often in our lives than when we're kids, right? Moms are always holding babies. We're always holding hands as we walk through Disneyland. You know, come on, come with me. Don't get lost. There's a billion people here, right? We're touching all the time when we're children. And so that's pretty important. But also, we tend to touch more in warmer climates. Now, you guys live in beautiful California. A little warm here. I'm from Arizona, Tucson. A little warm there. Actually, it wasn't that hard to draw me up to Utah. About 8 months of the year, it's pretty easy to say, you want to come to Utah? Yes, yes I do. Right? Utah has these cool things called seasons, which we don't have in Arizona.
Amen.
So we moved up there. But in warmer climates, it seems that there's much more skin availability than in colder climates. Think about, living in Wisconsin for 6 months of the year versus living in San Diego for 6 months of the year. There's much more skin available to touch in warmer climates than in non-warmer climates. The other thing that we find is that happier people tend to touch. And so when you think of, let's say, Seattle, Washington, it's cloudy most of the time. It rains almost every day and creates those beautiful green forests up there, but there tends to be a higher amount of depression there than there is in sunny San Diego. So happier people tend to touch more often. This was also an interesting study where they looked at romantic relationships, and I love this. This is one of the most romantic slides I could find. Isn't that a beautiful couple? Yeah. I love that one. So it tends to be that early on in our relationships, touch rises, right? You're dating, remember that sitting at the movies and the back of your hands touch, right? Your heart rate goes up, and then you're holding hands, right? And then there's the hug at the end of the night, right? So it starts to rise. And it tapers off somewhere early in marriage. That's about the highest amount of touch you'll get in a relationship. No more often than that. And then it begins to slow down. And that's okay. We think, oh, that's sad. Married couples should touch more. But really what we found is the greatest satisfaction in marriage is when your touch is reciprocated by your partner. The more often there's a one-to-one relationship between your touch, the more satisfaction you report. So you'll find couples that are high amount of touching in their relationship. They're holding hands all the time. They have their hands all over each other, or they've got their arm around each other all the time. And then those that aren't comfortable with that. But as long as there's reciprocation between the two, there's satisfaction in that marriage. So as it turns out, like a lot of things in relationship, satisfaction in marriage has more to do about how we respond to our partner's needs than how our needs are being responded to. I think that's an important lesson that we can learn from touching. So let's talk about who touches. So they did some studies. This is actually originally done in the 1960s, but then repeated in the 70s and 80s. We found that when you saw friends and romantic relationships in cafes, that in England, if you watch them for an hour, they touch 0 times. 0 times, okay? In the US, in bursts of enthusiasm, we touch twice in an hour between our friends and our relationships. Now, when you look at Latin America is about 154 times an hour. Touchy people, right? When they looked at Puerto Rico, this was an interesting one, it was 264 times an hour. Now, I don't know how much touching you can do in an hour, but that's a lot of touching in Puerto Rico. I mean, that's like, you're just, I don't know, do you hug the whole time you're talking for that hour? Does that count? But it's a lot of touching. So different areas of the world have different relationships. I grew up somewhat living in Iran. We lived in just outside of Tehran, Iran, for about 2 years. And I'll tell you that there you have to get used to, as men talk to men, you have to be close enough to touch each other's arms. And for those of us who grew up in the US, we have our bubble, right? But there, it's considered very rude if you're that far away. So you step into people when you talk, and you're like right there. I mean, like right there. And so just knowing those cultural differences is helpful as we deal with people from around the world. It's kind of interesting to see that. So no other form of communication is as universally understood as touches. The compassionate touch of a hand or a reassuring hug can take away our fears, soothe our anxieties, and fill the emptiness of being lonely. Please keep that in mind as you look to help other people in doTERRA. This is about the oils, but this is also about touching people, both emotionally and physically, and touching their lives for good. So let me tell you a little bit about my story. This is my crew. This is 4 of our 5 kids. We have a son who's not with us right now. He's actually in Germany doing a service mission for our church, and he'll be home in August. My wife is so excited. She gets to talk to him in 2 days. So we don't get phone calls from him very often. But on Mother's Day is one of those days that we're pretty excited about. But these are the people that influence my life. So much like Russell was saying, I think all of us at doTERRA, what helps us keep going and what helps move us is our family and having their support. But I want to tell you a little bit of story about this guy. This is Canyon. He's our 4th child. So back in January of 2012, and I got to get this right because the lady that had him is right there. I'll get this wrong. Back in January of 2012, Canyon was born to us. Canyon was born at 6 pounds 7 ounces-ish. 6 pounds 4 ounces. I'm a dad. I mean, really. I don't remember these
What are a
things.
few ounces?
But it took him 3 months to gain 1 pound. He was a pretty sick little guy, and it was pretty obvious early on that he was not doing well. There was something wrong with our little man. And he would cry all the time. He'd pull his legs up like his abdomen was hurting, like his stomach was hurting him. He would sleep for about 20 minutes at a time, and that's it. Which is really wearing on a mom, and then really wearing on a family when mom's not doing well, because baby's not doing well. So I started looking at my training, I started looking at my books, I started looking and looking, what's wrong with my son? What's going on? I have a medical degree, so I should be able to figure this out. So I looked and looked and looked, and I could find nothing. And so I spent hours on my knees in prayer, and nothing was coming. So we took him to his pediatrician. His pediatrician said, well, there's certainly something going on, so we started running tests. And he said, well, I don't know what's going on with Canyon. And it's heartbreaking as a father and also as a physician that should have the understanding of physiology to say, I can't help my own son. I can help lots of other people, but something's going on with my son that I can't fix. And I don't know what to do. And so we started seeking help from specialists at Primary Children's Hospital. Now, while this was going on, we had a friend of ours from across the street, Chriselle. She came over, and Chriselle said, hey, Julie, because she knew I was a doctor, and doctor's not going to do oil, right? So said, Julie, try this. Here's a little digestion. Rub it on his stomach, rub it on his feet, and just see if that helps, right? And so she did that, and miraculously, Canyon started sleeping. He slept for about 4 hours at a time now. And he seemed to calm. That crying all the time and that pulling his legs up seemed to slow down and subside a bit. And so we saw miraculous changes in our son with digestion oil. So now Dr. Riggs is going, well, wait, what's going on? Right? It was amazing to see the benefit that he got from this oil. Now, let me be clear about something. This did not heal our son. This did not fix him entirely. We still had to continue to seek for medical care, working hand in hand. There's this complementary, using the stuff that we now knew was helpful while we continue to seek medical care. And we found out by running into a gastroenterologist at Primary Children's Hospital in Utah that our son is allergic to the most natural thing in the world, breast milk.
Yeah.
And it wasn't like something she was eating, it wasn't part of her diet, it was about, I think he said 0.2% of the population is actually allergic to actual breast milk. You're like, that is the weirdest thing I've ever heard. But we took him off breast milk at about 3 months, and we put him on formula that cost, I think, about the same much as gold does. I'm not sure if it's ounce for ounce, but he began getting better, and he was gaining weight, he was calmer, he was doing okay. Ken, you want to come up? Come here, buddy. Let me introduce you to Ken. You can tell that none of this comes in his brain. He is a very, very tall 5-year-old. He is very rambunctious and has all sorts of energies. As a matter of fact, there are days when you go, can you just be a little sick so you can just lay there for a little bit? Oh, and Miss Savannah wants to come up on stage. This is Miss Savannah. She's our little 3-year-old princess. So, Canyon obviously is doing better. She's the brave one of the two. She's like, yeah, can I dance on stage? That's what she asked earlier. Dad doesn't want his daughter dancing on any stage. So that's our Canyon. Here's the most powerful influence in my life. This is my sweet wife, Julie. She's here. Put your hand up, Julie. This is my sweet wife, Julie. She brought essential oils into our home, and they've been a part of our home ever since. And I'll tell you that even as we began to use essential oils fairly regularly, we still were in this habit of reaching for the medicine cabinet, right? We'd be like, oh yeah, I know oils do these wonderful things, but where's this and where's that? Reaching for medicine. We finally had to take all of our medicines and put them on the top shelf and fill the medicine cabinet with oil, so that as we open them up, that muscle memory is, oh yeah, here's an oil for that, right? And now we use them very frequently. As a matter of fact, right before I came on stage, a whole lot of balance. But she is obviously my most powerful influence in my life. These are my parents. Let me tell you about why I'm here. How did Dr. Riggs come to be on the medical advisory board from doTERRA? These are my parents. My dad is very educated. He has a PhD. My mother has a master's degree. And they're both very smart people. And we traveled the world growing up. We lived, as I said, in Iran. We traveled Europe. But what we found as we traveled is that my mother became very interested in the medical cultures of the world, finding that often medicine is food and food is medicine, meaning those lines blur very easily in most other cultures. But not here. and so we were exposed to going to chiropractors and massage therapists. We took herbs a lot in our life growing up that she would find in the local markets for various things. And so we had lots of exposure to medical cultures. That was my experience in my home. So then I went to medical school. This is Dr. Andrew Weil. I went to University of Arizona. Anybody know Andy Weil? Andy's a great guy. He's a good friend of mine, and I did lots of training under Dr. Weil during medical school.
All right.
And he's a Harvard-trained physician, traveled a lot after medical school because he knew that Western medicine didn't hold all the answers. And so he wanted to know, where can we find other answers to healthcare issues rather than just in Western medicine? Galileo said this, all truths are easy to understand once they are discovered. The point is to discover them. So he came up with the scientific method. The scientific method is you form a hypothesis, you use an experiment to prove that hypothesis, correct or incorrect, you gather the results and you come to some conclusion about that. Now the scientific method is very important for those of us in medicine. We find that we need to have some sort of proof about how does something work and does it cause harm and what can we know about that. But the problem is this, we often mistake science for truth. And science is not truth. Science is the pursuit of truth. And I'll give you a couple of examples of this. When I was in medical school, we were taught every woman that's menopausal should be put on hormone replacement therapy. If you don't do this, you will be sued and you will end up losing your practice, right? So that was the dogma in the 1990s. And then I got into residency and they said, oh my gosh, no woman should be put on hormone replacement therapy if she's menopausal. And the reason that they found this out, they designed an 8-year study. They said, hey, we should find out how beneficial we're being to women. We're all great, we're wonderful doctors. Let's find out how good we're doing for them. And so we designed an 8-year study, and we said, we're gonna study this and see how well we're doing at preventing cardiovascular death and stroke. The study was stopped 5 years into the study because, as it turns out, we were killing women with hormone replacement therapy. And we said we can't even continue the 8 years. We're finding the data's coming in too strong that this actually is increasing cardiovascular death risk and increasing stroke risk. So we stopped the study early. Statin drugs for cholesterol. Statin drugs, probably when I was in medical school, the thought was put them in the water. They're so amazing and so beneficial, put them in the water. Now I will say this, statin drugs are beneficial at lowering cholesterol in certain populations that absolutely have to have their cholesterol lowered. But we're now finding more and more things. It increases your risk of hypertension, so now you have high cholesterol and high blood pressure. Both things in combination, not good for the heart. We're finding things that increases your risk of diabetes. Finding it decreases your CoQ10 in your bloodstream, and CoQ10 is helpful at lowering blood pressure. And all sorts of things are going on now with statin. We're finding maybe we don't use these as ubiquitously as we thought we were. We should probably be cautious about prescribing these medications because they can cause some significant problems. And then any number of drugs that have been recalled. We found Yaz, a birth control that was commonly prescribed. Yaz, 64% risk in increasing your risk of blood clots in your legs, deep vein thrombosis. Vioxx was increasing your risk of heart attack, recalled by the FDA. Now these were all things that went through the scientific method, went through the FDA approval, and were marketed as things that were beneficial to us. If you're on a statin, it increases your risk of shingles. You need to be careful, again, about using statin drugs. Recent research about psoriasis. There's an increased risk of cutaneous squamous cell carcinoma among patients that are systemically treated for psoriasis. These are not talking about topical things for psoriasis. This is talking about systemic treatment for psoriasis. Again, systemic treatments for psoriasis have been going on for years and years and years. But now we're finding maybe we be careful with this. This is important. So Marcus Garvey said, a people without a knowledge of their past history, origin, and culture is like a tree without roots. So then I needed to start looking at, where does my culture come from in medicine? Where does my tradition in medicine derive its roots from? This is what the past looks like. This is a mask that physicians wore during the Black Plague. They would put herbs in the nose of the mask to prevent from the bad air that was causing the Black Plague. We didn't really have that one right. We were wrong about that one. But now, physicians have more and more choices if we're open to them to treat our patients. If we're open to saying, look, there are appropriate times to refer to a massage therapist. There are appropriate times to refer to a chiropractor, an acupuncturist, a wellness advocate, and use other things other than traditional prescriptions. If we're open to that, we'll take better care of our patients. I will tell you that I sit on, one of the committees that I sit on is called the Value-Based Healthcare Committee in my organization, where we look at, as medicine changes, we need to make sure that we're bringing value to patients. We actually spend 17% of our gross domestic product, our GDP, a little over 17%, on healthcare in the US. Our next closest neighbor is Australia. They spend 9% of their GDP on healthcare. So we're spending a whole lot of money on healthcare. As it turns out, we actually have the highest infant mortality rate of any developed country in the world. And the lowest age of our average life expectancy in the US, out of any developed country. So the question is, are we getting a bang for our buck? We're not. We're not. We're spending way too much money and we're not getting the value out of that. And so we need to change, and healthcare is beginning to see that we need to change. And so now they're looking for solutions to this problem, and I think it's exciting to be on the leading edge of that change. To be right there and saying, look, if we look at other modalities of healthcare, we can bring better value because all these other countries already are. We should look to be doing the same here and finding better value within our healthcare. So why essential oils and why doTERRA? Plant and herbal medicine is where my profession is rooted. That's where we began as physicians. And doTERRA has a commitment to deliver the highest quality oils available on the market today with their CPTG grade oils. It's amazing. Now, I'm not going to go into what that all means because I would be embarrassing myself with Nicole here. So when Nicole gets up, she will be talking about this far more eloquently than I can. And so she'll talk about what that means. But let me assure you, just from a physician standpoint, that as I use medications, they have to go through certain testing to make sure that the medications are what they say they are, that the amount is correct, etc. And these oils are no different. These oils are no different in their testing. So there's now a new interest in old ways. I pulled this article out of February's Journal of Family Practice, and it says this. There's a lot of small print there, so you probably can't see it on the back, but it says, a sweet new solution for rosacea derived from New Zealand honey. And this is pretty cool because there's a product called Honevo, Honevo, that is 90% New Zealand Canuka honey and 10% glycerol. And this can treat psoriasis. They actually have shown that patients with severe psoriasis, it takes it down to mild or moderate psoriasis, and those that have moderate psoriasis, it will take it down to mild. So pretty interesting to see from mainstream medical literature this thing saying, hey, as it turns out, honey can help, right? And you go, wait, this is a medical journal, really? But more and more articles are coming out that are saying these things. This one was published in the Internal Medicine Journal of Cancer, published in 2017, February. Niacin found beneficial for squamous cell health. Okay, now this is one you're going to have to read between the lines because we want to be FDA compliant. But niacin helps reduce the risk of your squamous cells, skin cells, going bad on you. Okay, so it doesn't seem to affect basal cells, but it does significantly reduce squamous cell health or risk of problems with squamous cells. And then also this one, when they looked at low back pain, both acute and chronic. Now, when patients come to me with low back pain, I can prescribe some ibuprofen for them. I can prescribe some Flexeril for them from a traditional medicine standpoint. Now, obviously, we'll talk in a minute about the things that I actually do. But for this, traditional medicine would say, yep, do those things and maybe get into some physical therapy. This is actually a study that they looked at a number of studies across the U.S. and found out that the things that are most helpful for low back pain, both acute and chronic, are things like massage therapy, chiropractic care, acupuncture, and mindful meditation. So things like yoga, Tai Chi, Qigong, those sorts of things are better than the things that I can prescribe. And so if doctors would take a look at these and really take these to heart, and the patient comes in and says, hey, I've got back pain, rather than writing out the prescription for OxyContin, right, Percocet, etc., where we get major problems with, why not say, you know what, actually the literature says that this would be the best thing for you. Go seek your care from an acupuncturist or a chiropractor or someone else that does a better job than what I can do in traditional Western medicine. So let's talk amounts for a moment. This is important. This is important both in Western medicine and in oils. I have a patient that came to my office a couple years ago, and she was having some muscle aches and pains, and I said, what helps? And she says, well, if I take Tylenol every 2 hours, 1,000 milligrams, I'm fine. And I said, why are you taking that much? And she says, well, because it helps. And I said, well, do you like your liver? Because I do. And it's not going to be with us much longer if we keep doing this, right? So amounts are important. If a little helps, people often think a lot will be a whole lot better. And in fact, in this case, there becomes diminishing returns when we use too much. So as we talk about oils, we need to remember that about 2 to 3 drops every 4 to 6 hours applied is about enough. You shouldn't be doing any more than that. Now, I often get the question afterwards, when I'm seeing a patient will come up and say, people will come up and say, so, Dr. Riggs, but what if I'm using a blend? I'm using this one and this one and this one. I'm talking about any specific oil. I'm not talking about 2 drops of 4 oils combined to make 2 drops. You just can't do that, right? So 2 to 3 drops of any specific oil in combinations is fine, about every 4 to 6 hours. Again, diminishing returns as we increase that dose. So let me introduce you to my office. This is when you walk in the waiting room of my office, this is what you see. And there's a couple of reasons for this. Number one, patients across the board, research tells us this, are not willing to tell their physician what alternative things they're using. When we give an intake form, they'll list everything under the sun. I take an aspirin once a week. I take, but they will never tell us their alternative stuff. And that's not good. We need to know. And so this tells patients, look, you're going to come see Dr. Riggs today, but he is open to alternative medicine. So please make sure that you list that on your form. And the second thing that it communicates is when you come to see Dr. Riggs, he may not be prescribing a medication for you today. He may be making other recommendations that are non-traditional to help you get better without the issues that traditional medication can cause. This is the diffuser that sits on our back counter. A lot of folks think, oh, that's nice, you diffuse essential oils for your patients. Let me tell you, this is not for my patients. This is for my staff. So when I walk in on Monday morning and I get that look from my staff, it's like, oh my gosh, it's Monday and it's 8 a.m. and we've got a full schedule, right? And that's the, I can't even stay awake sort of a look. Well, what we'll do is we'll put some wild orange and some peppermint in the diffuser. Let's get everybody awake. Let's go and let's get the day started. And then come about Wednesday or Thursday when they start getting giddy about the weekend coming, and they're just like way too much energy. And I work with a bunch of ladies back there, right? It's like gets a little crazy. It's like, hey, some Serenity might be good about let's put some Serenity in the diffuser and get that going to calm everybody down just a little bit. We also use the On Guard wash to make sure from room to room we're not contaminating patients. So in every room we'll wash our hands with On Guard before we move to the next patient room. And then the things that we treat, the things that we deal with in our office, often we'll have patients coming in for, again, we're going to be compliant, head and neck tension. And what they're looking for their head and neck tension is an injection of promethazine and Toradol. And those were great at taking away head and neck tension. But the problem is this, promethazine is an anti-nausea medication, and it will cause them to sleep for about 6 hours. So if you're at work and you get head and neck tension and you come to the doctor's office, I'm going to give you an injection that's going to make you go to sleep for the next 6 hours, so you're going to miss the day of work. If you're a full-time mom, you can't miss 6 hours of your kids, right? Just run around, kids, you'll be fine. Mom's going to sleep, right? And so we've been using past tense in our office quite a bit. We'll say, look, let's try this. I'm going to put this on your forehead. I'm going to put this on your neck here, and I'm going to go to the next room and see a patient. When I come back, if you still need the injection, we'll give it to you. What we're seeing is about an 80% reduction in how often we have to give our injection to patients. Amazing. About 86% of all visits to a primary care office has a psychological component to it. So whether that be depression, anxiety, whether it be over the disease you have, whether it be over the symptoms you have, I'm not sure what's going on, but there's always or often a psychological component to this. And so we'll use a lot of lavender and serenity in the office to kind of decrease those feelings of anxiousness. And if it works for the patient, then we say, look, and I need you to understand something. So I don't refer all these patients to my wife. I'm like, yeah, just call Julie, she'll get you everything. I live in Utah, and lots of folks do doTERRA in Utah. So what I do is I say, look, here's what we use today. If you have a friend, a family member, a cousin, a niece that's using doTERRA, here's what we did today. Go talk to them, and they can get you what we use on you today. So we also use a lot of deep blue rub. When somebody comes in with a musculoskeletal issue, sprained ankles, etc., we'll put deep blue rub on them immediately to help decrease that tension of the muscles so that I can do an exam without them guarding against me doing an exam. I can really help determine what's going on there a whole lot better. We'll use lavender. We'll recommend lavender, vetiver, cedarwood, or petitgrain for a peaceful night's sleep. Now, I will tell you, has anybody used petitgrain for sleep?
Not yet.
I loved it. Like, it came out, I was a huge fan because, as Dave Hill put it, it's the man's lavender. Being a man, I'm not a huge fan of lavender. It doesn't smell that great to me. But so I started using petitgrain, and my wife initially, I'm going to tell him, my wife initially is like, "Don't put that stuff on before bed. I won't sleep with you. Don't do that." The last couple of weeks, she's been using petitgrain. And she's a fan. Like, it helps her sleep really well. She's been lathering up the kids with petitgrain. Like, it's been great. So we really love that one for the sleep effect that it has. The recipe that I like to use also for musculoskeletal issues, so for sprains and strains, is this lemongrass, white fir or Douglas fir, and wintergreen in equal parts. And if you can rub that on sore muscles and sore joints, that will actually really help alleviate a lot of that soreness. The chemistry of that is very powerful at that anti-inflammatory effect. So we recommend for patients who are having issues with significant illnesses in that they're getting sick quite often, and well, your immune system isn't doing so great, we recommend using On Guard, Melaleuca, oregano, both topically and internally. Support focus and concentration with Intune. Now, Intune, this is what I'm going to tell on me. My staff knows that at the end of the day, Dr. Riggs has lots of phone calls to return, lots of paperwork, lots of messages to look through, and I've just seen 30 patients. My brain is a little bit scattered. And so I go put my Intune on because I've got still about an hour and a half of focus that I've got to get done, and my brain is a little scrambled. So they know when they smell Intune in the office, leave Dr. Riggs alone. He is trying to get stuff done. So it is a signal for them that I've got stuff to do. And then also sinus health with lemon and cilantro. To keep those sinuses healthy against the environmental threats and to keep them healthy against the allergies that we commonly come across, we'll recommend actually lemon and cilantro to help with that. And you can use that in a sinus rinse with a saline. Very helpful for that. And then uplifting mood with citrus oils. Remember I said 86% of all visits to the doctor's office has a psychological component? So we deal with this all the time. Last year I was at a conference in Tucson, back home, and I was at a hotel, and I got checked into the hotel, went up to my room, I opened the balcony doors, and I was right above an orange grove in full bloom. Wow. Oh my gosh. Like, it smelled heavenly. And I'm thinking to myself, how can you be depressed when you're smelling this all the time? It was so great. And so I love those citrus oils for elevating mood and to helping us feel better about what's going on around us. This is our Canyon, right? Oil, Digest-Zen. We use a lot of Digest-Zen at our house because it helps aid in digestion, helps ease that stomach discomfort in a soothing and natural way. We love Digest-Zen for its benefits. And respiratory tract. So respiratory tract is a very common complaint when it comes to our office. Something going on with the respiratory tract, right? Because lots of things affect us as we breathe. When you think about the amount of toxins and chemicals that we breathe every day, it's a significant load. As a matter of fact, when coming in here, we parked in the parking garage, and there's a sign next to the elevators. You all should look at it as you go out. It says basically this. Let me just sum it up for you. This parking garage is full of horrible fumes for you, and you're breathing it in. I think that's what it said, essentially. And so respiratory tract issues are a really common complaint in our office. And so we go through a lot of breathe. As a matter of fact, I had a gentleman come in with some sinus health issues to me, and he'd been through my waiting room, and so he's sitting down, and he says, he's a friend of mine, I've been treating him for years, and he says, Dr. Riggs, so you're selling snake oils now, huh? And I laughed, and I said, no, we're not selling them, but I do use them quite a bit. And I said, what can I do for you today? He says, well, I'm not doing so well, as you can tell. And I'm like, okay, well, let's just try something. So I grabbed some Breathe and said, put 2 drops in your hand. So he did. Rub them together, cup them over your mouth and nose. And he breathes it in, and he takes another breath, and he's like, hand me the Kleenex, because it's just running, like it's just going there. And he says, well, that's why I'm here. I couldn't get this to unclog, and now I'm better. I'm like, well, great. Now you know what to do about it, right? And he was really happy with that. It was no longer snake oil to him. He's never made the comment again. So, just one experience. It is a great one. Also, if you have a spouse that snores, makes that horrible racket, it actually does help decrease that quite a bit. So it helps decrease that noise and racket. But let me close with this. Really, the answers that we need to have in medicine dovetail our traditional training in Western medicine and complementary and alternative training. We need to be looking at those answers that both integrate what we know and also what's new and being told to us and being proven now through research as to what can be helpful from the alternative world for patients. That is the way to get the best health care in the United States and across the world. Thank you so much for your time.